Good morning, good afternoon, good evening. Welcome and thank you for joining for this Happy Healthy Heart presentation. My name is Lexi Jetkins and I'm a registered dietitian and a wellness coordinator for the Kapnick Strive team. To start off our presentation, I have a question for you all. What is the leading cause of death in the United States? Is it diabetes, cancer, heart disease, or Alzheimer's disease? And I'm sure you probably already know the answer based on the title of today's presentation, because the answer is C, heart disease. Heart disease, this also includes coronary heart disease, hypertension, and stroke, and it remains to be the #1 cause of death within the United States. And cardiovascular diseases claim 659,000 lives each year, while all forms of cancer combined claim 599,000 lives. Coronary heart disease is the leading cause, 45% of deaths attributable to cardiovascular disease in the United States, followed by stroke at 16.5%, heart failure 8.5%, high blood pressure at 9.1%, and diseases of the arteries 3.2%, and other cardiovascular diseases. True or false? 1 in 10 women die from heart disease every year. What do you think? The answer is false. So in 2017, about 1 in every 5 female deaths were caused by heart disease. And heart disease is the #1 killer of women in the United States. So let's look at heart disease at a glance. About 1 person dies every 36 seconds in the United States from cardiovascular disease. In 2018, 1 in every 6 deaths from cardiovascular disease was due to a stroke. Someone in the United States has a stroke about every 40 seconds, and every 4 minutes someone dies of a stroke. And every year, more than 795,000 people in the United States have a stroke. And about 610 of that 795, it's their first or it's a new stroke. And heart disease does cost the United States a pretty penny, about 219 billion with a B each year. And true or false, the more education you have, the lower your risk of heart disease. What do you think? And this is true, but why? Something to keep in mind is correlation does not always mean causation, but typically those with higher education have higher paying jobs, so they can afford better quality food and gym memberships. They might live closer to a bigger town to have easier access to groceries, gyms, and healthcare access. So what are some of the signs and symptoms of a heart attack? If you know someone that has had a heart attack, or if you've seen a movie that someone had a heart attack, one of the first things that they will talk about is they have chest pain. They also can show or exhibit pain in the arms, back, shoulders, neck, or jaw, experience shortness of breath, breaking out in a cold sweat, feeling unusually tired for no reason, and sometimes for days. They may experience nausea, vomiting, sudden lightheadedness or dizziness, and have anxiety. And what are the signs and symptoms of a stroke? Face drooping, arm weakness, speech difficulty. And if you see anyone experiencing these symptoms, it's definitely time to call 911. Other signs and symptoms include blurred vision, coordination issues, difficulty swallowing, headache, mental confusion, and rapid involuntary eye movement. So what should you do? Well, let's start on the left-hand side with heart attack. So even if you're not sure it's a heart attack, have it checked out, and minutes matter, and we'll talk about this in a second. Call 911 and chew an aspirin if you are not allergic. The reason you need aspirin is the same reason you should call 911 without delay. A heart attack is a dynamic event, and early intervention can limit the damage. Most heart attacks develop when a cholesterol-laden plaque in a coronary artery ruptures. Relatively small plaques, which produce only partial blockages, are the ones most likely to rupture. And when they do, they attract platelets to the surface. And these platelets are tiny blood cells that trigger blood clotting. A clot or a thrombus builds upon that ruptured plaque, and as the clot grows, it blocks the artery. If the blockage is complete, it deprives a portion of the heart muscle of oxygen. And as a result, those muscle cells will die, and it's a heart attack. And aspirin, the reason to chew an aspirin is because it helps by inhibiting these platelets. And only a tiny amount is needed to inhibit all the platelets in the bloodstream. In fact, small amounts are better than high doses. But since the clot grows minute by minute, time is of the essence. And now if you look on the right side of this slide for a stroke, spot a stroke fast. So first, ask the person to smile, ask them to raise both arms, and ask them to repeat a simple sentence. And if they're having difficulty with multiple of these, it's definitely time to call 911. And also check the time when it first appeared. When an ambulance comes on, this might be one of the questions they first ask you. So what do you think? How many times does your heart beat each day? The answer is 100,000 beats per day. That's a lot. Our heart does not stop working. In an average lifetime, the human heart will beat more than 2.5 billion times. And speaking of heartbeats, who do you think, true or false, a man's average heartbeat is faster than a woman's? False. A woman's average heartbeat is faster than a man's by almost 8 beats per minute. The average man's heart rate is 70 beats per minute, and a woman's is 78 beats per minute. So what are the risk factors when it comes to heart disease? We have two different charts here, the uncontrollable and controllable. Starting on the left, uncontrollable means factors that we cannot change in our life. So gender, race, age, and our family history. Now looking on the right side, we have smoking, physical activity, nutrition, overweight, obesity, poor cholesterol, high blood pressure, diabetes, uncontrolled stress. This is all controllable because it is modifiable by lifestyle changes. And we will talk about those later within the presentation. And true or false, poor dental health can contribute to heart disease. And the answer is true. Studies have shown gum disease, periodontitis, is associated with increased risk of developing heart disease. Poor dental health increases the risk of bacterial infection in the bloodstream, which can affect the heart valves. And oral health may be particularly important if you have artificial heart valves. Tooth loss patterns are connected with coronary artery disease, and there is a strong connection between diabetes and cardiovascular disease, and evidence that people with diabetes benefit from periodontal treatment. So even though oral health isn't a key to heart disease prevention, it's important to take care of your teeth and gums. So as a reminder, brush your teeth twice a day, floss daily, and schedule those regular dental checkups and cleanings. So what can you do to prevent heart disease? The first one is exercise because it makes your heart stronger, more efficient. It helps lower blood pressure. It lowers your LDL, that bad cholesterol, and increases your HDL, your good cholesterol. It reduces the risk of cardiac event, and it increases your survival rate if you do happen to suffer from a cardiac event. So what types of exercises can you do? There are 3 different types: cardiovascular or aerobic exercise, strength training, and flexibility training. And we will go over each of these topics over the next few slides. So starting with cardiovascular exercise or aerobic exercise, it keeps your heart, lungs, and circulatory system healthy, and it improves your overall fitness. And cardiovascular exercise, or cardio, is an activity that raises your heart rate and breathing, which strengthens the heart and lungs. And over time, aerobic exercises reduces the risk of many diseases, including diabetes, heart disease, and stroke. Examples of this could be walking, running, swimming, biking, elliptical, dancing, put on your favorite tunes, and tennis. So how much should you do? The American Heart Association recommends at least 150 minutes of moderate intensity exercise or 75 minutes of vigorous exercise per week. That's about 30 minutes per day, 5 days a week. And if you're just starting out, don't rush it. Start with 10 to 15 minutes per day. You can also divide your time into 2 or 3 segments of 10 to 15 minutes per day. And before starting any new fitness regime, always, always, always talk to your doctor first. Moving on to strength training, it is weight-bearing exercise that uses free weights, machines, or your own body's resistance. Starting with your body is a great way to start before you start using those free weights or those machines. And the benefits of strength training include it strengthens your bones, muscles, connective tissues, it lowers your risk of injury, it increases muscle mass, which speeds up metabolism, and it just improves the quality of your life. The American Heart Association recommends strength training at least 2 times per week. And if you're just starting out, one set of 8 to 12 reps of each major muscle group is a great place. And again, always, always, always talk to your doctor first before starting a new fitness regime. And flexibility exercise. This stretches your muscles, which can help your body stay more flexible and allow for more freedom of movement. Stretch after every aerobic or strength training session, and it is more important to stretch after your exercise than before an exercise. So how do you perform this flexibility training? Get into a position and hold that stretch for about 10 to 30 seconds. Repeat each stretch 3 to 5 times. And you should be stretching until you feel some slight discomfort, but not pain. And remember, no bouncing when you are stretching because this can lead to injury. So where do you begin? Make the time and start small, but also make it fun. Beginning with small starts and starts like some of the examples I'm about to give you, and then you can build up from there. So these examples include parking your car at the far end of the parking lot so you can have farther to walk to the building's entrance. Choose the stairs rather than the elevator. Spend part of your lunch break walking. On bad weather days, try walking indoors at a mall. Wake up a bit earlier and exercise before you do anything. Or wear a wearable fitness tracker to count your steps. Try increasing your steps daily by 500 each week with the goal of reaching 10,000 steps per day, a level that can produce many health benefits. So, also eating for a healthy heart. Adopting better dietary habits is definitely essential to heart health. So some things that are really good for a healthy heart are berries, which are full of these heart healthy phytonutrients and soluble fiber. You can try blueberries, strawberries, cranberries, or raspberry in cereal or yogurt. Fruits such as orange, cantaloupe, and papaya are rich in beta carotene, potassium, magnesium, and fiber. Adding spinach, which really packs a punch. Use it in the sandwiches and salads instead of lettuce. Red, yellow, and orange veggies such as carrots, sweet potatoes, red peppers, and acorn squash are packed with carotenoids, fiber, and vitamins that help your heart. Crisp, fresh broccoli florets dipped in hummus. It's delicious, by the way. Don't knock it till you try it. Dipped in hummus are a terrific heart-healthy snack with a whopping list of nutrients, which includes vitamin C and E, potassium, folate, calcium, and fiber. You can add asparagus, which is filled with many nutrients like beta carotene, folate, and fiber, and only provide 25 calories per cup or 5 calories per large spear. You can also try tomatoes, even sun-dried varieties in winter months, which provide lycopene, vitamin C, and alpha and beta carotene. Eating omega-3s, which is awesome. So eat fish high in omega-3s, such as salmon, tuna, mackerel, herring, and trout. And if you can, aim to eat fish at least twice a week. And being a dietitian, I often hear from people, I don't like fish. What's something I could eat? Eat algae, which is the original source of omega-3. And it's the fish that snack on the algae, which is how they get that omega-3 source. Other omega-3 fats include walnuts, canola oil, and soybeans. You can also include flax seeds, which contain omega-3s, fatty acids, fiber, and phytoestrogens to boost that heart health. And take them in ground or milled form, which help reap those extra benefits. And then speaking of nuts, a handful of healthy nuts, such as almonds or walnuts, can satisfy your hunger and help your heart. Oatmeal is a great comfort food choice, full of nutrients and a great source of fiber. Dark beans such as kidney or black beans are high in fiber, B vitamins, minerals, and other good stuff. Dark chocolate, nobody turns that down, is good for your heart health, but just make sure it's at least 70% cocoa. And then leading to alcohol, a 4-ounce glass of red wine can help improve good HDL cholesterol levels. So up to 2 for men and 1 for women per day. So there are lots of choices out there to improve and eating for that healthy heart. So what should you watch out for? So some things that you should look out for are simple sugars, trans fat, saturated fat, white flour, cholesterol, and sodium. You should be limiting your sugar. For men, it's 37 grams per day, and women, it's 25 grams per day. When limiting saturated fat and trans fat, foods that can be high in that include fatty meat, poultry skin, bacon, sausage, whole milk, cream, and butter. And trans fats tend to be found in stick margarine, shortening, some fried foods, and packaged foods made with hydrogenated oil. So instead of butter or stick margarine, you can try reduced fat, whipped, or liquid spreads. Limit the amount of cholesterol that you eat to less than 200 milligrams per day. Some foods high in cholesterol include egg yolks. So one egg yolk has about 212 milligrams of cholesterol. Other sources that are high in cholesterol include fatty meats, whole milk, cheese, shrimp, lobster, and crab. And ending with sodium, limit your sodium to less than 2,000 milligrams per day, but limit sodium to 1,500 milligrams per day if you do have a high blood pressure. And it's good to select foods with no more than 140 milligrams per serving. Foods with more than 300 milligrams of sodium may not fit into a reduced sodium meal plan. And a low sodium salt diet may help prevent that buildup of extra water in the body. This may help prevent high blood pressure, heart failure, kidney disease, and other conditions in which swelling or fluid retention can occur. And even if you take a pill for blood pressure or a water pill like a diuretic to remove those fluids, it's still important to have less salt in your diet. And a rule of thumb, or just a note to remember, a fourth of a teaspoon of table salt has about 600 milligrams of sodium. So how can you make simple changes? Don't forget to check the serving size on the labels. If you eat more than one serving, you will get more sodium, trans fat, saturated fat than the amount listed. And you can find this on the nutrition label of multiple packaged foods. Also, use caution when eating outside of your home. Restaurants can be very high in sodium, and you don't always get the information about this. They don't really provide it on their menus. If you use canned food like canned beans, an easy tip is to rinse them. Doing this lowers the sodium content about 50%. You can also season your food with tart flavors. You can try a lemon or lime or vinegar. Hot flavors, peppers are very low in sodium, but hot sauce is salt. You can try herbs and spices like onions, garlic, and salt-free seasonings like Mrs. Dash. So as an overview, when it comes to nutrition and a healthy heart, limit your sodium, cholesterol, saturated and trans fat, and eat more omega-3s and fiber. True or false? About 1 of every 4 heart attacks is believed to be directly related to smoking. This is true. Smoking damages your entire cardiovascular system. Nicotine causes blood vessels to tighten, which restricts the flow of blood, and over time, the ongoing narrowing, along with the damage to the blood vessels, can cause peripheral artery disease. And smoking also raises blood pressure, weakens blood vessel walls, and increases blood clots. Together, this raises your risk of stroke. You're also at an increased risk of worsening heart disease if you've already had a heart bypass surgery, a heart attack, or a stent placed in a blood vessel. And it not only impacts your cardiovascular health, but also the health of those around you who don't smoke. Exposure to secondhand smoke carries the same risk to a non-smoker as someone who does not smoke. And these risks include stroke, heart attack, and heart disease. So if you are looking to quit, talk to your doctor. So how can you stress less? So what's stressful to one person isn't for another. Happy events such as new marriage, job promotion, new home, and unhappy events like illness, being overworked, family problems can cause stress. And when you're experiencing stress or that flight or fight response, in a stressful situation, your body releases a flood of chemicals called cortisol and epinephrine, also known as adrenaline, which prepares your body for action. So an extreme example, if the car in front of you were to burst into flames, you'd be ready to leap from your car and flee. Now, the car bursting into flames isn't normal, but fight or flight response is quite normal. And everyone feels and reacts to stress in different ways. And how much stress you experience and how you react to it can lead to a wide variety of health problems. And that's why it's critical to know what you can do about it. Stress may contribute to poor health behaviors linked to increased risk for heart disease and stroke, such as smoking, overeating, lack of physical activity, unhealthy diet, being overweight, and not taking medications as prescribed. And your body can respond to stress like a headache, a back strain, and stomach problems. It can also zap your energy, wreak havoc on your sleep, make you feel cranky, forgetful, or out of control. As said earlier, stress is normal and sometimes life-saving. But chronic stress is when stress is constant and your body is in high gear off and on for days or weeks at a time. Chronic stress may lead to high blood pressure, which can increase risk for heart attack and stroke. So if you want to turn your stress around and help your heart in the process, 5 simple tips: stay positive. People with heart disease who maintain an upbeat attitude are less likely to die than those who are negative, according to research. Just having a good laugh can help your heart. Laughter has been found to lower levels of stress hormones, reduce inflammation in the arteries, and increase that good HDL cholesterol. Another tip is to meditate. So this practice of that inward focusing thought and deep breathing has been shown to reduce heart disease risks, such as high blood pressure. And anyone can learn to meditate. Just take a few minutes to sit somewhere quiet, close your eyes, and focus on your breathing. Meditation's close relatives, yoga and prayer, can also help you relax that body and mind. Number 3, we've already talked about this, exercise. Every time you are physically active, whether you take a walk or play tennis, your body releases those mood-boosting chemicals called endorphins. And exercising not only melts away that stress, but it also protects against heart disease by lowering your blood pressure, strengthening your heart muscles, and helping you maintain a healthy weight. 4 is unplug. So it's impossible to escape the stress when it follows you everywhere. So it's time to cut the cord. I'm telling you now. Avoid those emails and TV news. Take time each day, even if it's just for 10 or 15 minutes, even 5 minutes. We all have 5 minutes to spare. We probably are on our phones a lot longer than that. So just cut the cord, spend 5 to 15 minutes to escape from the world. So I really enjoy having an unplugged day, 1 day a month, where I don't have any interaction with a television, phone, or computer, whatever it may be. And it's actually really nice. You should try it. Another tip is getting enough sleep. Adults should aim for about 7 to 9 hours a night. And then finally, find your own path to stress relief. Some of the options that I gave you earlier may not be for you. So find your own path to stress relief. That could be taking a bubble bath, listening to music, reading a book, making times with friends and family, or simply just taking a nap. Any technique is effective if it works for you. And figuring out how stress pushes your buttons is an important step in dealing with it. Identify sources of stress in your life and look for ways to reduce and manage them. A healthcare professional can help you find ways to manage your stress. And there are also stress management or relaxation classes that can help. You can find them at a community college, rehab programs, hospitals, or by calling a therapist in your community. And adopting serenity in the face of life's challenges may help improve your perception of stress and result in better quality of life and heart health. So get to know your numbers. So blood pressure consists of 2 different numbers. Your systolic pressure measures the pressure of walls against the artery walls. Let me start that over. Your systolic pressure measures the pressure of blood against artery walls when the heart pumps blood out during a heartbeat, while your diastolic pressure measures the same measure between heartbeats when the heart fills with blood. And both of these numbers are important. Just because one is normal doesn't mean you're off the hook. And normal blood pressure is 120/80. And please check your blood pressure more frequently if you have high blood pressure or you're borderline. High blood pressure and high cholesterol don't have symptoms. Sometimes it's called the silent killer. So be sure to see your doctor even if you feel okay. And tell your doctor about any changes or unusual symptoms that you may have. And if you can only remember one number, your waist size is the one to know. Why, you may ask? Because better than your weight or your BMI, your waist size predicts your heart disease risk. If your waist size is equal to or more than 35 inches in women and equal to or more than 40 inches in men, it increases your risk of cardiovascular disease, diabetes, metabolic problems, high blood pressure, and abnormal cholesterol. So, time to test yourself. Your heart rate recovery. This is easy to do. So, if you perform an exercise, take your heart rate at the end of the exercise, right after, and then wait 2 minutes, and then take your heart rate again, and then you subtract the difference. Your heart rate recovery signifies the total time taken by the heart rate to restore its normal activity or functioning after moderate to severe exercise. A better recovery heart rate that is marked by early normalization of the heart rate after the moderate physical activity suggests a healthy heart and well-conditioned heart. A failure to drop heart rate more than 12 beats per minute after exercise cessation reflects a high risk of sudden cardiac death. But the good news is that there is a lot that you can do to prevent that heart disease. And you can take some of the examples that we gave earlier within this presentation. And that is all that I have for you today. I want to thank everyone for coming. And please reach out to us if you have any questions.